Okay, my name is Robertson. I'm in Section 4, Professor Ellis's class, and today I'm going to be doing the basic IV skills. We're going to be doing blood transfusion by doctor's orders. I've also already confirmed the patient's blood type, and I'm going to go ahead and prepare everything for the IV insertion. I'm going to go ahead and flush. First, I'm going to go ahead and hand hygiene. Gloves. Okay, we're going to go ahead and flush the IV line to prepare. Unlock it. Okay. Going to go ahead and lock it back. So that is prepared. Okay. I'm going to be using a 20 gauge needle to perform the blood transfusion, so we don't have any issues with that. So now I'm going to go ahead and take my gloves off, go into my patient's room. Before I do that, I'm going to go ahead and get my tape ready so I don't have to fidget with that. Okay, go in the patient's room. Hi, my name is Troy. I'll be your student. I'll be your nurse today. Can you please state your name and your date of birth for me, Mr. Tonto?
Darren Tonto, 6'3", 75.
Okay, that is correct. Do you know if you have any allergies, sir?
I do not.
Okay, have you had any upper body surgeries that would prevent anything?
No, I haven't.
Okay. What's your dominant hand for me?
My left.
Okay, I'm going to go ahead and do the IV on your right. So if you just give me your arm real quick, I'm going to go ahead and look for your veins. Okay, they look good. Okay, so I'm going to go ahead and prep the site. Circular motion, working inside out. Okay, I'm going to go ahead and perform hand hygiene before that. I'm going to go ahead and do it now. Don gloves. Okay. So I'm going to go ahead and place the tourniquet. Okay. I'm going to go ahead and get my room ready. Okay. Okay, I got to check his pulse before I can go ahead and do this. Okay, it's working. And I'm going to go bevel side up into the site. I'm going to stabilize the vein and go down at a 15-degree angle. Okay, I see blood return. I'm going to go ahead and advance the catheter and pull out the needle slowly. Apply pressure. This would go in the sharps. Attach my INT. We're going to go ahead and check for blood return. I see blood, and then we're going to go ahead and flush the line. Okay, so I'm going to take my pieces of tape. I'm going to tape it to it. I'm going to release the tourniquet. Apply my tegaderm, which I'm going to write the patient's name, my name, the date and time that it was done. Okay. Apply the tegaderm. That's good. And we're going to also tape the INT to the arm so there's no risk of it coming out. Okay, and so then I'm done with that procedure. Then I would go ahead and check the arm for any inflammation, which I see none. Also, I would see if there's any, ask him if is there any, do you feel any tenderness, anything? Okay, and then I would go ahead and report what arm I did it on, the time, the date that I did it on the first attempt, and then I report the gauge, which was a 20 gauge needle for a blood transfusion, which was done, and then And then that'd be it. Robertson, I'm in Professor Ellis's class, section 4. I'm going to be placing an NG tube today on Mrs. Smith. Okay, I have a doctor's order to place the NG tube up to suctioning. Now we're going to go ahead and go into the patient's room to inform her of the procedure. Mrs. Smith, how are you doing today? Good? Great. Can you tell me your name and date of birth? All right, yep, that appears to be your name and date of birth. Okay, now I'm going to go ahead and assess her nares, see which one's bigger, which one's patent. There can be no redness, no tenderness, no bleeding. It all needs to be clear so the NG tube will pass smoothly. Okay. The right one seems to be the bigger one in this case, as it is in most cases. So we're going to do the right nostril for this NG tube placement. So first I'm going to go ahead and measure from the tip of the nose to the ear to the xiphoid process, which is going to be right there, which I'm going to mark that with a piece of tape. Okay, so I've marked that. I'm going to go ahead and lube 4 inches of the end of the tube. Okay, so we're going to put you in a high Fowler's, which you're already in, Mrs. Smith, okay? You're going to feel a little bit of choking, and then I'm going to want you to sip some water, okay? So help it go down, all right? Okay, glad you understand. Okay, here we go. All right, and now sip water, sip, sip. All right, good, good job. Almost there. Okay, we're in. Good job. We're gonna go ahead and tape that real quick. Okay, good job. Okay, so now we're going to go ahead and make sure we're in the right place. So we're going to hook this up. And I see bile in there, so we know we are in the stomach. Okay, so there's that. Can you tell me your name real quick, just so we know where it's at? Okay, good. Now I'm going to go ahead and do an air bolus in there so we make sure we know that we're in there, okay? Okay, I do hear the swishing sound to confirm as well that we are in the stomach. I'm going to go ahead and pin this to her gown. Okay, let's pin your gown. Now we're going to hook you up to suctioning, okay? Okay. Alright, so if you have any pain or tenderness, you just let me know, okay? Alright, thank you. Okay, so now I would go ahead and document that I place an NG tube in the right nostril. We did receive bile from the NG tube, so we know we are in the correct placement. Also, the swishing noise was also present when auscultated. So there's the NG tube. Okay, now we're going to irrigate the NG tube. Okay, so I'm going to go ahead and have pre-filled up 10 milliliters of normal saline that we can go ahead and flush with. Go ahead and apply another clean pair of gloves. Go ahead and remove her from suction so it all works. Okay, so we're going to check the placement again. So we're going to put some air into it. Then we're going to get some bile out. Okay, we've got the bile. Push it back. Okay, so we are in the correct place. We're going to take the 30 milliliters of normal saline. We're going to flush it in there, and it should come back due to positive pressure. Okay, everything is in the right place. Are you feeling okay? Good. Okay, I'm going to hook you back up to suction, okay? Alright, if you have any issues, feel any pain, anything starts coming back up, you just let me know, okay? And I'll be right back in. Okay, then I would go ahead and document that I checked the placement of the NG tube again, which is in the right nair. I irrigated it with 30 milliliters of normal saline, and I did get some bile back in the NG tube. That's all. Section 4, Professor Ellis's class. I've got a physician's order to hang some normal saline on my patient. I'm going to go ahead and get all that ready before I go into the room. Okay. I've checked all his labs. They're fine. No known allergies that have been reported. Okay, so I'm going to go ahead and drop some saline for the flush. Great. Okay. Okay, now I'm going to go ahead and hang my tubing in my bag. We have normal saline, 500 milliliters, and we're going to run this over an hour. We also have a drop factor of 10, which is going to give us 83 drops per minute. Okay, so I'm going to go ahead and label the bag with the name of the patient, my initials, what I'm hanging. Just going to get it right there. And then I'm going to take my tubing. Clean it as well, along with the port. We're going to spike it. We're going to hang it. Okay, and then we're going to go ahead and flush the line, prime it, make sure it's all working good. All right. Prime. Okay. And now we're going to go into the patient's room. Okay. How you doing, Miss Betty? Doing all right today?
Wonderful.
Okay. The doctor told me I need to give you some normal saline. Have you ever had this done before?
Yes.
Okay. So I'm going to go ahead and check your IV site real quick, make sure there's no infiltration, phlebitis. It's all pretty tender. Can you state your name and date of birth for me?
Betty White.
Okay. What's your date of
Oh,
birth?
date of birth is March 7th, 1842.
Okay, man, you're getting up there. Okay. Okay, I'm going to go ahead and flush your line real quick using the stop-start method. First, I would do hand hygiene and put some gloves on. Okay. Okay, I would go ahead and clean this real quick. Make sure it's all clean. Okay, start. Okay. Clamp it first. Okay, the line is clear. We're going to clamp that back. Okay. Okay, before I start, we're going to go ahead and label the tubing with name, date, what it's using. Okay, that's labeled. Okay, I'm going to go ahead and hook you up, alright? Go ahead and get the line. We've already primed it. We're going to go ahead and make sure we clean the ports. Okay, now that we're hooked up there, we're going to make sure the flow's going good. Okay, we had a drop rate of 83, so we're going to time that out. Okay, it looks to be about 83. Okay, we're going to leave that there, and we're going to, how you feeling? You feeling okay?
Yes, wonderful.
Okay. All right, I'm going to come back in an hour and check on this, make sure we're doing okay. Then I would leave the room, clean up all my trash, document that I hung a normal bag of saline in the right arm. Patient tolerated the procedure well, no complications, and I'll be back in an hour. In an hour, since I've hung the normal saline, it's about out, so I'm going to go ahead and the doctor has ordered some vancomycin for his infection. Vancomycin binds to the cell wall for severe systemic infections. It's bactericidal. I would monitor their white blood count, which is going to be elevated during an infection. For the first time that they've ever had vancomycin, I would do a C and S test to see if they're allergic to vancomycin. Signs and symptoms of vancomycin would be red man syndrome, flushing of the face, and GI distress. It also causes nephro and ototoxicity. It's contraindicated in people who are taking aminoglycosides, are taking diuretics, aspirin, and of course allergic to vancomycin. To see if they are allergic to this, I would test their cranial nerve number 8, which is the whisper test. I would also monitor the renal function and check for red man syndrome. The doctor has ordered 1 gram of vancomycin. It is available in 500 milligrams per milliliter, so I would go ahead and administer 2 milliliters to him. I'm also going to go ahead and calculate the drop factor while I'm here. It comes in a 50 milliliter bag, so over an hour times the drop factor is going to be 8 drops per minute, just so we have that. So I'm going to go ahead and draw up my vancomycin. Top of it. We're going to drop 2. Okay. There's 2 milliliters of vancomycin, and I'm going to go ahead and inject this into the bag. Before I do that, I'm going to go ahead and write on a label it with vancomycin, the name of the patient, my initials, and the time. Okay, so we're going to go ahead and inject this. We're going to clean the port before we do it. Okay, it's injected in there. Okay, so I'm going to go ahead and hang the bag up there. Okay, and now I'm going to go ahead and get out my tubing. Okay, I'm going to go ahead and label the tubing before I put it up there with the same things, date, time, what it is. Go ahead and spike the bag. Okay, I'm going to go ahead and flush real quick. Okay, there we go. Okay, so everything's prepared, and now we're going to go into the patient's room. Hi, Mr. Smith. How you doing today?
Doing good.
Okay, can you tell me your name and date of birth?
Yes, Mr. Smith, born January 1st, 1967.
Alright, thank you. It's been an hour since we did your normal saline, so we're going to give you some vancomycin, okay? Have you ever had vancomycin before?
Yes.
Okay, it's just for your infection, so we're just going to administer this to you, okay? Your IV site looks good. I'm going to go ahead and put on some gloves. Perform hand hygiene, put on some gloves. Your IV site looks good, no infiltration, no phlebitis, no swelling. Is there any tenderness when I touch it?
No.
No? Okay, good. Alright, well, I'm going to go ahead and give you your Vanco. So we're going to go ahead and slow your drop rate down from 83, which is what your saline was at. Okay. Go ahead and hook your Vanco up. We're going to clean the ports. Okay. Now we're going to make your drop rate to 8, which we previously said. But then, before we do that, we're going to go ahead and drop your bag of saline. Okay. So then we're going to set this to 8. Open that. Okay, that's about 8 drops per minute. Okay, you feeling okay?
Yeah.
Okay. The call bell's right here. So if you have any tingling, numbness, if you start feeling a little woozy, just let me know, okay? I'll be just outside.
Okay, thank you.
Okay, then I will clean up my mess, then I will go document that I did administer vancomycin into the INT at on 9/2 at 12 o'clock. Patient tolerated procedure well, and he has a call bell if he needs me. I'll be back in an hour whenever it's done. Okay, the vancomycin is done. It's been an hour. I'm going to go ahead and disconnect the vancomycin for the patient and see how he tolerated it. How you doing, Mr. Johnson?
Doing okay.
Did that vancomycin treat you pretty well?
Oh, yeah.
Okay. Obviously, it still looks good. No inflammation, no infiltration, no phlebitis. Can you state your name for me and date of birth again?
John Smith, January 1st, 1967.
Okay, thank you very much. Okay, we're going to go ahead and disconnect you from the vancomycin real quick. We're going to turn all of it off. Put the alligator clamp on there. Clean it off. I'll be wearing gloves at this point still. Okay, now we're going to reset your drop rate back to the 83 drops per minute. Okay, that's 83 drops per minute. Okay, so you're still feeling okay?
Yep.
Okay, I'm gonna leave the call bell here. Just let me know if you have any problems, need anything, need some orange juice, I can get that for you. Okay?
All right, thank
Alright,
you.
have a good day. Okay, then I would clean the rest of this up. I would go document that he tolerated the vancomycin well. The vancomycin is done. He's back on the normal saline at 83 drops per minute. He has the call bell, and he's instructed if he has any issues to let me know. Thank you.